There are countless other examples of efficiencies that we could build into the system. I'll give you another example. We have 47 million Americans who have no coverage at all. We have about 87 million Americans who on an annual basis have no coverage, but some of them bounce in and out because they lose their job, they lose their coverage, they don't have it for 5 months, then they get it back, so they're not without it for the whole year, but we have 87 million Americans who are without it at some period during a year. Now, you all may say to yourselves, well, hey man, that's their problem, not mine, and I've got my coverage, so I'm okay. You're wrong. You're paying for them. You're paying for them anyway. But you're paying for them in the most inefficient way possible. Because you pay for them at the back end when they are diagnosed with a disease that is further down the road and that is far more expensive to be able to cure. And I'll give you an example. Diabetes. Diabetes is treatable at early stages, and it's treatable with pills, and it's treatable through diet and other mechanisms. But if you don't get a screening and you wind up with diabetes, likelihood is you're going to be a candidate for either dialysis or amputation. And we waste, I am told by experts, about $100 billion a year just on diabetes alone, where we could have screened it earlier and been able to make a savings. Doesn't it make sense? Therefore, to think about, okay, wouldn't it be good if we got some of those people screened early for cancer? Here, I'm another example of that. I had prostate cancer a few years ago. I was lucky, actually, that my wife noticed the tick up in the PSA, not the doctor. And she's the one, I didn't even notice it. And she's the one who said to me, hey, you better, check on this. So I go back and check on it, and I find out that, well, maybe you ought to have an ultrasound, and I said, okay, I'll get an ultrasound, what do I know? So I'm on the table getting an ultrasound, which if any of you have ever had it in that particular place is not a lot of fun. And in the middle of the ultrasound, the doctor tells me, well, this isn't fail-safe as to whether or not you have cancer. And I just startled up on that table and I said, then what am I doing here? I want to know, what is fail-safe? Is there a mechanism? Yes, you got to have a biopsy. So I said, well, for God's sakes, get the guy in here who can do the biopsy, and get the biopsy done, and lo and behold, 2 days before Christmas, a few days later, I learned that I had prostate cancer. But it was early, folks. Early stage. I was lucky. Particularly among African Americans, they don't get early stage intervention, and particularly among African Americans, there's a higher incidence of prostate cancer. But if you're male and 50 years old, I'm looking around, I see a lot of 50-year-olds, you're 50% chance you have prostate cancer. It goes up tenfold every 10 years. 60 years old, 60% chance, 70 years old, 70% chance. That's how it works. And that's why it's so important to have the screenings and be able to have coverage, because you can save people unbelievable heartache as well as save us all a lot of money. Now, I'm just going to give you very quickly sort of what the problem is. Then I'm going to give you a quick what happens if we don't do anything. So I told you 87 million people don't have any health care. I told you with 50% more money you're spending today for less result. We have about 25 million Americans who are underinsured, meaning that they just don't have enough medical insurance to be able to keep the bill collector at bay, so they're weighed down by it. We have American families, every single one of you that I'm looking at here, are paying a hidden tax of about $1,100 a year right now. You're paying it for the people who aren't covered, who then go to the hospital, and it gets passed down to you one way or the other through premiums, deductibles, other kinds of things that come at you in the system.